And so the old business that we are looking at is, we're going to just kind of go down the list. So March Vision, we had a discussion last time about the difference between ODs and OMD billing. Do you guys have an update for us on that?
See, Lee, guys, did I see you coming in?
You did. I was just getting off mute.
Okay, thank you.
I thought that, and Dr. Munson, you can certainly correct me because I've slept between this meeting and the last meeting. And unfortunately, I've been off work for a little bit. So, well, I should say, fortunately, I've been off work for a little bit too. The billing discussion was mostly involved with the MCOs. Is that not correct?
Yes, it's so it's the billing because in our state law, there's not to be any discrimination between the two, and they have different billing for the same codes for MDs versus ODs. Right,
and so I think the updates that you need maybe are from the MCOs.
Yes, yeah. So March Vision is who we're asking this question of.
I'm sorry, Lee. I was not even thinking.
Good. At least it wasn't just me.
Is someone from March Vision on?
I think Scott Edmonds on. Isn't that who he's with?
Scott, are you're I see you on here.
Muted.
And it may also not be March Vision. It may actually be something that United Healthcare has to address because they are the parent company that is, they're paying out some to OMDs, and then March Vision is in charge of all the OD payments. And so that actually may be a little bit of a mistype that, so if there's anyone on from United Healthcare, they may be able to speak to that.
And I think they have us credentialed through different entities as well. So.
Okay, well.
I thought I was going to call Steve Edmonds or Scott Edmonds rather.
Yeah, I mean, I see him on here, but he's muted and there's no video.
Can you please unmute Scott so we can? I keep losing him. I don't know now. I think is. Okay, he's not coming on, so I'll see what I can get somebody to get a hold of him or somebody from United Healthcare.
Okay, and we'll see. I'll kind of skip ahead then, and if he's not on the call at all, then we'll just put this back on for the next meeting. If he does jump on, maybe we'll see if we can get some answers, because I don't believe there's anybody that responded from United Healthcare that's on the call either. So we'll have to table all of theirs. Okay, and so the next matter of old business is with the visas, and this was specific to Dr. Burchett's office, and where he was unable to be on this meeting today, he asked that we table that, and that will be brought up at the next meeting. So then we can go ahead and skip on to a question for DMS. We had a question about the code 66982. It was emailed to Justin Deeringer. And then we just wanted to see if DMS had an update for us on if and when that would be added to the vision fee schedule.
Well, I asked Justin to cover another meeting today. But we had a conflict for at this particular meeting, and my apologies because I did not see the agenda, or I would have switched with him. I can tell you this for sure. I can't give you a response on what Justin has, what the code is and whether or not for sure that, you know, as long as it's not an additional service that we haven't covered before. If it's an additional service we haven't covered before, there'll have to be a lot of review and likely won't be added in time for the updated fee schedules for January. However, if it's not, it may be added as soon as we're able to determine a rate for it. We would have to give the MCOs notice of that change, and it will take them 30 days, I think. And any of the MCOs can jump in and say, no, that it has to be more than that before they would be responsible for it. We will make it effective. If we add it right away, we'll make it effective January 1st.
Okay, well, can I ask this then, Lee? Is there a possibility that you could communicate this question to Justin and he could maybe email
Absolutely.
a response to it? Okay.
Oh, absolutely. I'm sorry.
Okay. No, that would be fantastic.
Yeah, and that was the last part of, I was just waiting to see if any of the MCLs were going to jump in and correct me on that 30 days. We'll get a response back to you all, send it to Charlie, and she'll send it out to everybody.
Okay, that is fantastic. Thank you.
You're welcome.
Dr. Munson, this is a good point to, or a good time to point out that this is why we need the agenda sooner, because we can get, I didn't get, I was out yesterday, so I didn't get the agenda to this morning that Sarah sent yesterday. And so we need this a little sooner so we can make sure we have appropriate staff and give our, get our stuff lined up so we can give you all answers. So if we can get that agenda, we'd usually like to have the agenda 10 days before a meeting. Then if we have to pull data and so forth, the agenda, you can, unless it's a special called meeting, you can always add to it the day of the meeting. But if it's not, if it's like this regularly scheduled meeting, we would like to have the agenda 10 days in advance. That way, if we have to pull data to get you all's answers to some of the items on the agendas, or if we have to do research, it gives us plenty of time.
Okay, and I apologize, that's on us. Sarah did ask us, what we needed to have on the agenda, and I'm sure we were busy seeing patients and did not respond in a timely manner. So we will make sure that we do that in the future.
And the other thing that happened, Charlie, you sent the dates out, but none of us sent them to Sarah or Donna. So they didn't know until the MAC meeting last week that we had a TAC meeting this week.
Oh, okay.
So that's on us. That's on us. Yeah.
All right. Well,
We'll do better.
All right.
Charlie,
Yes.
Charlie, maybe we should add Sarah and or Donna to the that distribution list. I don't know if the TAC would need to make a motion and ask for that, but that might be a good idea if they're, helping to staff the TAC that way. And I apologize for not showing any video today. I can't move you to the screen where my camera is, and B, my internet is the same as Charlie's. And so who knows when we're going to cut out.
Hi there. This is Tanya from March Vision. I think, so Ann and I both were trying to respond to you guys, but no one could hear us. So I logged out and logged back in. Can you hear me now?
Yes, we
Yes.
Okay. Sorry
Yeah,
about that.
This is Scott Edmonds. Similar. I couldn't seem to get off of mute either. So, I got it fixed.
Oh, good.
Yep, me
Thank
too.
you all.
Well, then we will circle back up to your part of the old business, as you can see on the agenda. So first item was the difference between ODs and OMD in the billing discussion from last meeting. So what insight can you provide us?
So in Kentucky, and Dr. Edmonds, I can speak to this if you want, unless you have a response.
Yeah, I was just going to say that we have Dr. Jaco now on that board looking at optometric billing issues. So he's a Kentucky licensed optometrist as part of our peer review team now. We actually meet tomorrow. But he will make sure that optometrists are paid appropriately. But I can't speak for how he will treat the ophthalmologist. So he is able to discriminate in your favor since he's going to be making the decisions relative to payment for optometrists in your state. So, but it won't apply to the ophthalmologists. So they're handled under we're only talking about surgical procedures not within your scope anyway. But those procedures that are not within your scope, he doesn't have authority over ophthalmology procedures. So he can only speak to everything within your scope. So he's going to be your point person to be able to help, any differentiation. So I think you'll get more than a fair shake.
Okay, so I think that may confuse two different items, but one that's perfect, that is totally within the statute to have a Kentucky optometrist to review those claims. So that's fantastic that Dr. Jaco has been added for that. But I think this is what Dr. Compton had brought up last time. So Dr. Compton, can you maybe speak to that to give a little bit more clarity so they understand where we're coming from?
Yes, my issue was with OMDs being credentialed through United Healthcare. And they're asking the ODs to be credentialed through March Vision. And by statute, it's got to be the same. And then fees, we don't want any discrimination on fees, whether it's against the OMDs or against us. We want parity, equity. So we want to make sure of that. But by statute, there's no discrimination across the board. It's just not fees. It's everything. I just want to make sure we're all up to snuff and doing it the right way.
Yeah, so that wouldn't be a question for us. We don't have don't have a contract with any of the payers to do the ophthalmology surgery and facility, et cetera. So it would be up to the payer to delegate that to us, in which case we would step up and be able to do that. But we're contractually limited to optometry and scope of optometry. Now, ophthalmologists that do care within the scope of optometry is included in this, but like cataract surgery, retina surgery, we don't have March has no purview over that. So, but we can certainly ask the payer to move it over to us, and in which case we would step up and be able.
I think we're still missing the point. It shouldn't be just, we should be treated just the same as the OMDs. As far what, for instance, if I didn't have a dispensary, I don't want to do any of your eyewear, I should credential through United Healthcare just like they do, not have to go through March.
No, what'll happen is that they'll have to go through March. You won't change, but if we push this, they'll have to go through March. We'll have to credential because they have no capacity to credential optometrists, or frankly, what they do, they just read ophthalmologists like any other physician, and they can do physicians, but they can't do us. So what'll happen is the ophthalmologist will credential through us, and we'll be happy to push for that.
Well, I mean, I think you have to. It's the law.
Is there anyone on from United Healthcare that can speak to that, or just March Vision present today?
Well, March is a subsidiary of United, so we kind of cross back and forth. But there's nobody on the United side. There's no ophthalmologist over there or capacity. So what would happen is the ophthalmologist would have to credential through March, because March is a medical eye plan. It's not a vision plan.
Okay, so just to kind of summarize what Dr. Compton was saying, so that would mean that either OMDs and ODs either are credentialed through United Healthcare, or OMDs and ODs are credentialed through March. It can't be a mix and match unless it is the same opportunity for credentialing for each provider type, ODs and OMDs, because as defined by Medicare, ODs are physicians. So that is something that maybe we're going to put again for next meeting to get a little more clarity, just to make sure that the statutes within Kentucky are being followed by both March Vision and United Healthcare.
Okay, we'll bring that up to the client to make sure that they can, then that, what the process that would happen to make that would be the OMDs would credential through March.
And then payment would be done all through March. United Healthcare would be out of the OMD space completely.
A total eye care carve out, as I think some of the other vendors probably have here. and we would be happy to do that.
Okay. Okay, and then the next question does also kind of fall on the United Healthcare side, potentially. It's the discussion on the co-management of cataract surgery. And I think that this is part of what brought this question up. So if the OMDs are billing United Healthcare for their cataract surgery, and then there is co-management, and that is co-managed by an optometrist, then that flips over to the March Vision side. And so can you maybe detail a little better how that is handled?
Yeah, we pay co-management just like Medicare. So it's, 20% based on time. You use the 55 modifier, that all happens the same, we coordinate those benefits and it happens the same. Just the checks come from a different place.
Did any of the ODs on the call have issues with that? Was that something that you had issues with in your practice, Dr. Compton or Dr.
I brought it up.
Sawyer?
I brought it
Okay.
up because my cataract surgeon had been told by United Healthcare that they didn't co-manage cataract surgery, and I'd sent him some March Vision patients, but we got paid. I don't know if he got paid or not, but we got
Right.
paid.
That's exactly right. So the capacity to do this is on the March side. I don't know whether he got paid or not. Good question. He may not, because I said we can't speak for what they do. But clearly, the optometrists will get paid through March. Using the 55 modifier. So you're taken care of.
Okay. Well, thank you for clarifying that. And then the next question was the policy on medical refractions per year. Medical refraction being a refraction done outside of a routine exam for some cataracts, diabetes, those type of things.
I don't know, have the answer to that. Maybe Ty has that, or somebody from our team. That's not, we haven't tiered out refractions. Refractions is the same code. Refractions, just how it's paid. I'm not sure whether it's paid under with a medical diagnosis like a cataract relative, refraction relative to a cataract or relative to keratoconus. That would be different. I would think they might get just paid as without comment if the diagnosis for the refraction is keratoconus or cataract, or a refractive diagnosis that's not presbyopia or myopia or hyperopia. But I'll let some of my colleagues respond to that.
Yeah, Dr. Edmonds, I'm going to have to look into that one and get back to you guys on it, because I want to make sure that I am speaking correctly. I'm going to check with claims to see what we have tied there.
Yeah, I believe
Okay.
the answer would be the doctor would have to code the refraction with a diagnosis that would be one that Dr. Jaco thinks is within this would be medically necessary for that procedure, because there are medically necessary refractions to see what the best vision is, even if you don't prescribe it. So that would be appropriate, but it would just be then you would tag the refractive 92015 with
Right.
cataract or keratoconus or whatever reason why you would need to do an
Diabetes with complications.
Yeah, but and I think those are going to be approved by Dr. Jaco. He's got to update the whole list. And what the other option would be, for the payer, again, get over the credentialing issue, is once Dr. Jaco signs off on the list, that they use that for the ophthalmologist too, which is another thing we've recommended, is take this algorithm that he's approved and use it for MDs. But we can't enforce that.
Okay. And then the last one, I'm going to apologize because this, I don't exactly know what it's referring to. So office help or LCD references only. Does anyone else on the call remember what that's referring to?
I think when we had that discussion last week, there was confusion that LCD, and they're vary all over the country, is for Medicare, not for Medicaid. So it doesn't apply to Medicaid. So if you've got a Medicare patient, you're going to have LCD, which is set up by the payer. Again, I would wonder whether a Kentucky optometrist gets an input into the LCD, but that's not my problem. But I can assure you on the Medicaid side, it will be Dr. Jaco that will give you that, what LCD does for you, because that's his task. He will create its own database that's for Kentucky Medicaid for our contracts that he's approved. But he does not need to stick with LCD or any other. He's going to be able to do that, with his own judgment.
Okay. Okay, so that sums up all the old business for March Vision. And so do any other of the TAC committee members have any other questions on any of this old business for March? Okay, hearing none, we're going to move on to the new business. We would just kind of like to know, and I'm going to guess it's all going to be on the portal, but the new vision fee schedule rates. If the different payers can just tell us where our providers can find those the new fee schedule rates for 2022, that would be nice.
This is
So
not
I'll just
Avisis.
go.
I'm sorry.
I was going to say Avisis first. You beat me to it.
I know, the lucky alphabet. Actually, we have a question for Lee with DMS. We look to see if the new 2022 procedure codes are out on the DMS website. We haven't seen those yet. When do you anticipate those will be available? Can you maybe unmute, Lee?
Yeah, I'm sorry.
That's okay.
Sometimes I lose my cursor and it takes me a minute to find it again. As soon as they are reviewed completely and we are assured that they are ready to go, so they should be up soon.
Okay, because we do have some providers that are attempting to bill the new 22 codes. And because those codes are not in your system, our encounters are going to deny. So we
No, they
can't.
won't. No, they won't. They won't deny. Okay.
The encounters won't deny.
Not that I'm aware of. You guys have always waited and said, I'm sorry, the managed care organizations have always wanted to know when our fee schedules are going to be posted so that you can rely on them to continue your business. However, there's nothing in your contract, in the MCO's contract with Medicaid, that says that our fee schedules have to be posted before you can continue your business with Medicaid providers.
Okay,
So-
this isn't regarding fee schedules. This is in regards to procedure codes. So if Avisis allows a claim to process for a new code that DMS does not have in their system, that encounter will deny as an invalid procedure code.
Okay, I'm gonna have to take your word for it right now because I don't necessarily believe that's correct, but that's okay. We'll go with it.
Okay, we do have, I can provide you with some past history of examples of claims.
No, that's not necessary. I'm sorry that I didn't mean to say that you had to convince me of it.
Okay,
I just don't think so. I'm not the person that keeps that sort of knowledge on the top of the list of things that I know. And
okay,
that's all I was saying. I
Is
will
there-
find out. But you're telling, I think that, are you telling the Optometric TAC that you're not going to start paying from the 2022 vision codes until we publish our fee schedule?
it's not the fee schedule that we need you to publish. We need the new codes added to your system so that your system will recognize the new codes for encounter purposes.
Okay.
So, yeah, it's not.
You all have a technical phone call.
You're referring to the MCOs? Do they have a technical phone call with
The
the
MCOs have a technical phone call meeting. Well, it's a phone call now. That's
Yeah.
what I meant. But you'll have a technical meeting. The MCOs have a technical meeting with Medicaid, and that is the better question taken up during that technical meeting.
Okay. So I see Stuart is on from WellCare. Stuart, if we could request that that's added to the next agenda, I will also work with Aetna and Humana, and we'll work with Aetna and Humana for them to add it to their agendas too. Thank you.
Yes, will do.
Great. And we'll send you an email to provide you with examples of the new 2022 codes, the ones that we have been receiving and claims for so far that we unfortunately haven't been able to process.
Thank you.
You're welcome.
And just to be clear, are you speaking about procedure codes that have not been added or diagnosis codes that have not been added?
Danny, can you help me with that one? Is it just procedure code related? And I apologize, I'm referring to Danny from the Avisus
That's
team.
okay.
Yeah, that's okay.
That
So
one?
it is procedure codes. For instance, they added a couple of cataract surgeries. So we just need to know whether they will be covered, and if they are covered, what would be the reimbursement?
Okay.
Yeah,
Okay.
there are three, this is John Davis of iQuest. There are actually, I believe, 3 different codes within scope of optometric practice that were added to CPT this year. And those are CPT 1s. I'm not talking about the CPT 3s that were added.
And so that does kind of circle back to our question for Justin Derringer, which is falls on us for not getting our agenda out. But that sounds like that is his purview as far as codes that will be added to our fee schedules. And that makes sense that if those codes aren't on there, then you don't have the ability to assign or put that on your fee schedule if they've not been approved by DMS yet. So I think that is something that we'll table for now and see if we can't get these answers when we have our next meeting. But if in the meantime, which I think obviously before May 5th, we would be able to have all those answers, if that's something that the MCOs have the ability to push out either to our membership, to Sarah at the KOA, where we could also push it out that, hey, the 2022 fee schedules have been released. Here's how, as a provider, you find them. Which again, I'm going to assume every answer is going to be, hey, they're on the portal. But that would be something that would be nice, just so our membership has the idea or the knowledge when that is available for them. Okay, so the next on the new business is quality-based outcomes reviews that were discussed at the MAC meeting. I'm going to let Dr. Compton speak to that as he is our MAC member.
Okay, I'm unmuted. I just, and Lee or somebody from DMS can speak to this because I didn't understand it perfectly, but my understanding was that this outcome reviews they're going to interview the chairman of every TAC to talk about quality outcomes and I don't know what all. I just want to make sure that our chairman was aware, and I wonder what sort of, I don't want the outcomes just to be refractive outcomes. I want to
Dr.
talk.
Compton, that was
Yeah.
Angie Parker that said that, and I
Yes.
don't believe Angie is on today. I think she had a conflict. I think we had several meetings scheduled for the same time today, so they kind of divided up staff. And I don't believe she has reached out to anybody, but she will be contacting me to get all the chairs' contact information of each of the TACs. So it will include the optometric TAC as well.
Okay. And I mean, there's some, I guess with an interview, they can, Matt can bring up the items that need to be discussed, but I just want to throw it out there so everybody on the TAC was aware of what was going to happen.
Hi, this is Dr. Terrio. Yes, it's for the quality strategy that has to be updated every 3 years. So the last one was done in 2019, and this one is obviously being done now. And because it's a quality strategy, we really thought it was important to have as much input as possible. And so doing key informant interviews with the heads of all the TACs seems like a good way to get everyone's input. But it will basically be discussing the old quality strategy and what's happened in the meantime, and then going forward, what needs to be done to make Kentucky a healthier state.
Okay, I just want to make everyone aware, and we'll go from there.
Okay, fantastic. Thank
So-
you for that.
So just final note on that. This is just an informative really statement, right, Steve? I mean, none of this has occurred yet. We're not, right? This is just going to happen this year. They're going to create these
Right.
meetings and you all are going to,
It's
some of the folks-
informative. It's informative, and I don't want our TAC just to be
Okay.
limited to vision outcomes.
Good.
We
Okay.
need to discuss diabetic outcomes, cataract surgery outcomes, glaucoma outcomes, and make sure we're doing a better job or the best job we can. And I just don't want to get pigeonholed into refractive.
Absolutely. Well, and that kind of mimics the MIPS reporting that we have to do, because it does highlight all of those disease states, Dr. Compton. And that's something that we need to make sure that DMS is aware that we are providers in that scope as well.
Correct.
Okay, great. And then we also asked of DMS about a week ago and haven't had a response. And so we're kind of throwing this out for DMS and then also for the MCOs. If there is a number of Kentucky optometrists that participate in Medicaid, and then also how many Kentucky dentists participate in Medicaid, just to see the penetrance of the providers for this insurance subset. So I don't know if anyone on the call from DMS would have that answer, or if the MCOs have the answer of how many participating Kentucky licensed optometrists are on their panels.
Certainly Medicaid can provide that information to you. We don't have it handy because it changes.
Okay.
Can you give me a time frame that you're looking for, please?
This was not my request, so I would say a month. Is that a lot of time or not a lot of time in your world?
No, I'm sorry. I'm sorry. I didn't phrase my question adequately. Your answer is fine, but the question, what I meant was, what time period would you like us to report on? So do you want to know how many dentists and how many optometrists were enrolled in Medicaid as of the end of December 2021? Or do you want some other sort of time frame?
Probably as close to real-time data. So whenever your like last reporting period would be, or most up-to-date numbers. So if December of 2021 is your most up-to-date, that'd be fine.
Okay. It will probably be January, the end of January 2022.
Okay. Perfect.
Is there
Thank you,
anything
Lee.
that you want to know besides the number?
That is all I have been made aware of, but
Okay.
I am happy if there's anything else to reach out to you, but I think that that's it, just an actual number.
Okay. Thank you.
Thank you. And then one other, and under the new business, and this is for the MCOs, this was a question from one of your providers. Do we have any rules about putting Medicaid patients on a waiting list to be seen? Meaning Medicaid patients versus non-Medicaid patients? Or is there a number of patients per day of Medicaid that are, like if you can say, you know, I have this many slots per day that can be put with Medicaid patients. Is there anything from the MCO perspectives on that, or from DMS perspectives on that for our providers?
Hello, Dr. Munson. This is Nicole with Avisis. And I will ask that please, Kathy or Stuart, please interrupt me if I state something that's not in line with your current practices on the medical side. It's my understanding that we ask that you treat the Medicaid recipients as you would your commercial and Medicare population. So if you have a wait list that you have in place for the other lines of business that you participate in, it's fine that the Medicaid recipients are held to that same standard. If your process would be set aside just for Medicaid patients, then we would ask that you not please do that practice with the Aetna, Humana, and WellCare lines of business, because it's my understanding also, according to the DMS contract, the patients have to be treated like everyone else.
Okay.
This is John Davis from iQuest. I'd like to just, mirror Nicole's words there. This is, I don't know who asked that question. I think it was just an informative question too, but it's blatantly against the law, I suspect, against, or at least Medicaid regulation, I would suspect. So definitely, if we heard of this from many of our providers at iQuest, this would be quickly dashed. I mean, that provider would be educated pretty fast.
Okay.
Because we would, as she said, we would expect them to treat their Medicaid patients no differently than their commercial patients or their private patients.
And then also, if I can add on, Dr. Munson, we do understand, the situation that everyone is, especially in COVID, getting out of COVID, kind of back into the COVID, and there is a backed up demand of patients that need to be treated because you didn't have the appointment time to treat patients due to COVID. So we are informing our patients that where you could get into a provider's office within 1 or 2 days, or you may be able to get into a provider within a week, please expect delays. And sometimes the offices will have list of open, or a list of patients that they can call for last minute cancellations or for cancellations within a day or two, and they will get back to them. So we are asking our patients to be understanding and a little flexible, because the offices are really trying to treat everyone. It's just due to our current conditions, we have to make do with what we have.
Okay. All right. I appreciate that response, and we will communicate back to the member. So that is the end of new business that we had on our agenda. So Dr. Upchurch, Dr. Compton, Dr. Sawyer, did you have anything else that you wanted to add today, or anything else that you felt we needed to discuss?
I do not.
I do not.
Okay.
Other than, are we meeting virtually in May or in person, or wait till closer to time?
As just the chair for today, I do not have any idea. I would say that when it gets closer to May, we'll be able to make that decision. I love virtual meetings because you can do it in your living room. So that is something that we'll just come closer to the time and then make that decision together. So as you can see too, the 2022 TAC dates are May 5th, August 4th, and November 10th, all 1 p.m. 1 p.m. start times. And so once it gets closer to that May 5th date, we will decide if it's in person or if it's virtual, with plenty of time for those that would be traveling to know about that. And then the only other last thing on my agenda today was, just so everyone on this phone call knows, Charlie is retiring. So Charlie Hughes will not be on our calls. She will not be sending us the wonderful emails that she does so well to communicate with all of us. So I wish you well in your retirement. We appreciate all of your help and effort with the Optometric TAC thus far, but I'm sure retirement is going to be a lot more exciting than being on Zoom calls. But we really do appreciate your time and effort on our behalf. Well,
thank you, Dr. Munson. I appreciate that. After this week, I think it's with my family, I'm getting ready for full retirement. It's been a rough week, so I'm ready to go on retirement for a little while.
Well, we are happy for you to start that new chapter in your life.
It's been a joy to work with you all.
Congratulations.
Well, we really appreciate it.
Yeah, you got us all in line, especially with your early name tags. And they have seen us all over the Zoom. Thank you. You did an awesome job.
Thank you.
Okay, well, that is all that I have today. So I would be happy to entertain a motion to adjourn.
I'll make that motion. We adjourn. This is Dr. Upchurch.
Compton, second.
All right. Thank you all so much. Everybody stay dry and healthy.
You too.
You too.
Thank you.
Thank you again, Charlotte.
Thank you.
Bye.